Yeah, good afternoon. As I told you that we have started revision classes now. So today I would like to discuss about cohort study. Yesterday we discussed about randomized control trial (RCT), and as I am telling you that we are not going to cover point to point in detail. We are going to cover it in brief since it is a revision classes. All these things have been taught to you in detail in your theory lectures at some point of time. Okay, so let's discuss about cohort study. So the content of these presentations are like other names, definition, indicator, procedure. We'll just start. So there are types of studies. What are the types of studies? Okay, there are observational studies, there are experimental studies. So when we say observational studies, we observe. What do? We just observe. We do not try to change anything. We do not give any medication. We do not give any preventive procedures. We do not give any lifestyle modification. Nothing. We do not do anything. We just observe. When we say we observe, like for example, what is the prevalence of hypertension in Hyderabad? That is an observational study, right? Now, if I say, does statins or does 18 ACE inhibitors change the hypertensive status of a population? That becomes a interventional study. So intervening is intervention, and intervention is an experiment. Okay. Now, observational studies are of two types, mainly descriptive and analytical. So, sorry. So, observational studies are descriptive studies and analytical studies. In descriptive studies, it describes disease by time, place, and person. So, how do we do descriptive analysis? We describe any disease like hypertension, diabetes, or cardiovascular diseases by time, in which time it's occurring, place, in which place it's occurring, and person means defining the person means population. Okay. Now coming to analytical studies, it is ecological study, cross-sectional study, case control study, and cohort study. So today we will discuss about cohort study. All the studies moves in time. Cross-sectional study means cross-secting a time. Cohort study, again we are following the cohort. And case control study means already we have cases and we are looking backward and trying to compare to the controls. Okay. Experimental studies are randomized control trial, field trial, and community trials. Okay. Okay, so there are other names of this cohort study. It is also called as prospective study. It is also called as longitudinal study. It is also called as incident study, and it is also called as forward-looking study. Okay, so there are other names of cohort study. Don't get confused. Prospective study, longitudinal study, incident study, and forward-looking study are the same, right? What is a cohort? When we say cohort, where did this word came from? A group of individuals sharing the same experience or characteristics by age, occupation, exposure to the drug or vaccine or pregnancy, for example, or follow up for specified period of, and these people are followed up for the specified period of time. Okay, in example, birth cohort, that means the people who are taking birth in, so for example, say in the month of January, that becomes a birth cohort of January to 2020. And marriage cohort, like the people who are taking doing marriages in 2020 or maybe 3 months in winter, that is marriage cohort. Means you can make cohorts according to your definition and need of the study. And any exposure cohort, like for example the people who are exposed to poor nutritional diet, they may have many different diseases. So for example, exposed to poor nutritive diet, that means either junk food or maybe low nutritive diets. Okay, so you can make your own cohort. Yeah, so this is the place where, if I'm not wrong, this was a Greek warriors, where the word came, the cohort word came because they used to form small groups, mean small cohort of warriors, and they used to fight in groups. So the word came from this. Okay, so there were group of small. They created small group instead of big army. They created small groups, and then they used to attack from various different sides and all. So that is why it is known as cohort. So the word came from there. Okay. Okay. Now follow. Okay, follow up period. You guys can understand here. Now, what we are in cohort study, what do? We take a number. Just a minute. Yeah, I hope you understand. We take a number of people. Means we define our cohort. We take a number of group of people, and then we follow up in time. So this is a cross section of time. For example, uh, you want to study some status of hypertension and incidence of hypertension in each year for next 10 years or 5 years. So you will take group of people and you will start following them in, for example, 2020, then 2021, then 2022, then 2023, then 2024, then 2025. So if you follow them like this for 5 years, and if you define that you will be following them for first 6 months, means January to July, yeah, January to June, and in each 6 months you will follow them up periodically, and then you will see how many people develops incidence. Now for example, you start with the people who do not have any exposure and all, and you are following them after 3 years. For example, on fourth year there are two people who got this particular disease, like these two people developed hypertension, and then you see in fifth year they some more people got developed hypertension. Now these two are still here, right? You added three more people to this thing, this incidence. The incidence of three more people came in. Total it became five, and then again some more people increased here. Okay, by the end of follow. Now these two people, these are incidences. The new cases which are coming up in each or different year are incidences, but the old cases which are being followed up, like for example, I don't know how to use this pen, but I will try to use this pen. So for example, these are old cases. These are old cases by the end of new year, by the end of study. These are new cases. These are old cases, and this is also old case, and this is also old case. Now, by the end of the study, this one is by the end of the study, this is incidence, this is incidence, this case is incidence, but the other cases will come under old cases. So these are new cases, these are old cases. The old cases will be considered in prevalence. The incidence will be considered as here these two are incidents, here these three are incidents, here these two are incidents. Okay, I hope you understand. Incidence means new cases, prevalence means new cohort. Okay, cohort study, this is very important. It is a forward looking study. Okay, forward from cause to effect means there is a cause, that there is a risk factor, and then you're following it forward till the person gets the disease. Okay. Okay. Now indications. When there is good evidence of exposure and disease, so indications. When should we do cohort study? When there is a good evidence of evidence of exposure, means you know that the exposure is more in this population, and there is a good evidence that the exposure exists. Okay, so when there is a good evidence of exposure, when exposure is rare, when exposure is rare, but incidence of disease is higher among exposed, and when follow-up is easy, when ample of funds are available to follow up, right? This is a costly study, this requires funding, so it should be ample of, yeah. Okay. Now backward direction. So there are case control studies, like for example, if you compare cohort study to case control study, what is the difference? On the left hand side there is exposure, then the right hand side there is outcome. From exposure to outcome, like for example, there is a obesity is a exposure, outcome is hypertension. So obesity to hypertension, if you move time moves in a forward direction. But when you do case control study, we take people with hypertension here, like outcomes, and with no hypertension here as a control, and then we go back to the literature which may be available, if at all available. We look back into the literature and see what are the what were the causes which led to this hypertension. Okay, and we analyze the factors. So this is backward, means you started from the disease and you are going backward in time to see the so this is also known as report based study. Okay, you also see reports and get the data. Now in forward direction, cohort study is forward looking study. That means you take people with exposure, like for example, the previous example, obesity. If we take people with obesity and we take people with no obesity, we divide them into two, means we actually take entire study population and then timely follow them up, and then we see if somebody developed obesity, non-obesity, and then go forward till some time, and then see what are the how many people got hypertension, how many people did not get hypertension. As I said yesterday also, it is a similar plan of randomized control trial. But in randomized control trial, what do? We do randomization. where the investigator do randomization and he introduces the exposure. Here we do not introduce exposure, we just follow them up and just measure, just record it if the exposure developed or not developed. Now procedure of cohort study, again probably the same flow chart. So define the study participant. We take a defined study participant, like for example, if I take elderly population above 60 years of age is my study population. I want to study elderly people over 60 years of age. Then we see exposed and not exposed, right? Then we see people who are exposed and who are not exposed from Telangana. For example, I take study from Telangana, and then I look forward, and then I see how many people developed the disease, how many people did not develop the disease, how many people in both the groups. Procedure of cohort study. General consideration in assembling cohorts. Okay, both the groups should be free of the disease under the study. Okay. Now, procedure of cohort study is, in general condition, it is in assembling cohort, both the groups should be free of the disease under the study. Both the groups should both the groups should be equally susceptible to the disease under the study. Both the groups should be comparable, and diagnostic and eligibility criteria for the study should be defined well in advance. Follow-up of the group under same identical conditions over the period of time or determine the outcomes, which is onset of the disease or disability or death. Now, when I say okay, now type of studies, right? Prospective cohort study, retrospective historical cohort study, and prospective study in retrospect. So these are some complicated terms. I think you can stick to don't go into the variations of the different types of studies. Stick to the prospective cohort study. Okay. Framingham longitudinal study is the very famous study on cardiovascular risk factors and other these things, specifically oriented to cardiovascular disease patients and cardiovascular health of the population. Okay, these are the examples of that. Now, coming to elements of cohort study, selection of study subjects. First is selection of study subjects. Second, obtaining Now, elements of cohort study is like selection of a study subject. Now, in selection of the study subject, you can take a general population. When you take a general population, the whole population in the area, exposures cause fairly frequent in the population. Okay. Now, when you take a representative sample, if the population is very large, the exposed and unexposed segment of the representative sample should be representative of the corresponding segment of general population. Okay, so you take a representative sample of the whole population. You cannot take a whole population as your for your study. You always take sample of the study who can be a representative of the population. Now, special group of population like readily be, which can readily be studied. Now, when selection, the examples are occupation groups, professional groups, like doctors, like nurses, like truck drivers, like policemen. So these are already subgroups in the entire population, which are readily available and can be explored immediately and easily. Okay. Now, exposure group is a person who having exposure to some physical, chemical, or biological agent. Okay. Now, and some facilities classification of cohort members according to the degree of duration of exposure to the suspected factor. So there are exposure group like somebody got exposed to the X-rays, somebody got exposed to the injuries, some people. So these are exposure groups. So obtaining data for exposure, I'll be quick in reading the headings right now, not going into the details. Cohort members, review of records, then medical examination or special test or environmental surveys we can do. Right? These are the examples above. Sorry. So you can do internal comparison, external comparison, or comparison with the general population rate. So when you say internal comparison, only one cohort is involved in the study and then subclassified into internal comparison done. Like you take a cohort of people with diabetes. So you will study only diabetes and then follow them up, follow them up, and then you divide them into two groups like type 1 diabetes or type 2 diabetes, and then you study some comparative this thing. So this is internal comparison. You take one cohort, like for example you take cohort of cardiovascular disease and start studying cohort of cardiovascular disease, then subdivide them into hypertensive, non-hypertensive cardiovascular diseases. Okay. External comparison, more than one cohort in the study for the purpose of the comparison. Now you can take multiple cohorts and then you separately make another group and then compare it. Yeah, like for example, the that may not be matched cohort clearly. That may be a different cohort, and like for example, doctors versus engineers, radiologist versus ophthalmologist, and all those things, right? Okay, yeah, give me a minute. I'm not able to see you clearly. Okay, right. In comparison with the general population, if no comparison group is available with the from the same population and you do not have any comparative group, the rates and ratios can be compared with the general population from the previous studies. So cancer rates of uranium miners versus cancer in the general population and all like that. Elements of elements of cohort study is okay. Elements of cohort study are follow again. So one of the element of the cohort study follow. The follow-up is the most critical part of the analysis for the study. Obtain data about outcomes to determine morbidity or death. Mailed questionnaires, telephone cell calls, personal interviews, periodic medical examination of each member of the cohort, and reviewing records. Surveillance of the death records are some of the examples. Some loss to follow-up is inevitable. We have already discussed loss to follow-up in randomized control trial. Analysis of cohort study. Sorry. Analysis of the cohort study is the calculation of incidence rates among exposed and non-exposed groups and estimating the risk ratio. Estimating the risk. Now I'm not discussing this. You guys know incidence, how to calculate incidence rates. We'll discuss it separately. Now risk measurement of cohort study. Okay. So this is the analysis part, biostatistical part. We will discuss it in biostatistics and we will revise biostatistics. So these are the examples of that. Now advantages and disadvantages of cohort study. So what are the advantages and disadvantages? So the advantages of cohort study is you can calculate incidence. You can calculate incidence in cohort study, and disadvantage. Let's discuss advantages. So you can calculate incidence. Then there are several outcomes related to exposure here. Direct estimate of relative risk. You can directly estimate the relative risk, and it can establish cause and effect. Right? Yeah. And disadvantages are of it often requires large sample, ineffective for rare diseases. It is long time to it takes long time to complete. There are administrative issues here because you need a bigger team to work on cohort study. And losses to follow-ups are more because it's a longitudinal study that takes the duration of the study is long, so people may tend to fall out even after 1 year, 2 year, 3 year, like that. It is expensive study, and the changes in the standard methods of diagnostic criteria of disease over period is prolonged follow-up, and there are some ethical issues may crop in terms of enrolling the participants and all. So differences between case control study and cohort study, this also comes as a short note most of the time. So case control study proceeds from effect to cause, and cohort study proceeds from cause to effect. This is the main finding, most important this thing. Okay. It starts with the disease, and in cohort study it starts with the people exposed to the risk factor or suspected cause. The case control study, the tests suspected cause occur more frequently in those with disease than among those without the disease. In cohort study, the test whether the disease occurs more frequently in those exposed than in those not similarly exposed. Usually, the first approach to the testing of the hypothesis, it is the first approach to the testing of the hypothesis, case control study, and cohort study, it is a reserved for testing of the precisely formulated hypothesis. Case control study, you require fewer number of subjects. In large number cohort study, you require large number of subjects. Case control study, you get quick results, and cohort study, it takes longer time to get the results. Case control study, it's suitable for rare diseases, and cohort study is not appropriate for the diseases which are rare in conditions. And case control study, odds ratio can be calculated, and in cohort study, incidence rates, risk ratio, and attributable risk ratios can be calculated. Case control study cannot yield information about disease other than that selected for the study. The cohort study can yield information about more than one disease outcome. Case control study is inexpensive, means less expensive. Case control study is expensive. Thank you for today. So we discussed about cohort study, and and I don't know if we have time. We have only 5 minutes. I'll see if I had two presentations. If I had missed something, I can discuss with you guys. These are from the research workshop presentations. So forget about, pardon, couple of the slides. Okay. Okay, this is the plan of cohort study. Okay. If you want to draw the whole diagram, you can draw it. So you have a cohort of people. You find out, means that becomes your study participants. Then you follow them up and for a certain time, and then you see some people are exposed, some people are not exposed, and then you follow them up in time, another time, and then you see how many developed the disease, how many did not develop the disease, how many developed the disease and did not develop the disease in both the groups, and then compare. Let's design cohorts. These are from the workshop, so okay, so I think we discussed everything. There is nothing new here. So we discussed about cohort study briefly, and the details you guys can study it from the theory. Thank you. We will discuss about biases and confounders in our next class. Okay, thank you. And case control.